I'm Dr. Mihir Wagh in the Division of Gastroenterology at the University of Colorado in Denver. I'm an associate professor in the interventional endoscopy section and head of endoscopic surgery and tissue apposition. Thank you for watching. Thank you for listening in, and I'd encourage you to read our study, which is being published in Gastrointestinal Endoscopy. The study is titled Per Oral Endoscopic Tunneling for Restoration of the Esophagus, or POETRE, a novel submucosal dissection technique for therapy of complete esophageal obstruction. The reason we came up with this novel endoscopic technique is to help patients with complete esophageal obstruction. As you know, this may happen after chemotherapy or radiation or surgery for head and neck or thoracic cancers, and these patients have a complete obstruction of the esophagus, where if an endoscope is passed through the mouth, there's a complete obstruction, a blind end to the esophagus. And lumen restoration in these patients has been described by using two simultaneous scopes, one which is passed through the mouth, the other one through a G-tube tract, which is passed retrograde and then up the esophagus. And using this technique, a rendezvous technique, a needle can be used to puncture through the obstruction, or use endoscopic ultrasound or various other devices to reconnect the obstructed esophagus. However, this is not often possible where the length of the obstruction is longer, typically more than 3 centimeters. And so we thought that in these patients, we could come up with a way of reconnecting their esophagus and help these patients to swallow by using a technique similar to per oral endoscopic myotomy, or POEM, which we have been doing now for some years for treatment of achalasia. And so this is a kind of a spin-off from POEM, and we called it POETRE. So we had POEM, now we have POETRE. And what we do here is that, just like POEM, we tunnel through the submucosa of the esophagus, and instead of doing a myotomy like you would in POEM, we dissect through the fibrotic stricture, through the complete obstruction, while we are watching from the opposite side with the other scope. So this is also a dual scope technique where one is introduced through the mouth, the other scope is through the G-tube tract and through the stomach and up the esophagus. And so this technique allows us to reconstruct and reconnect the esophagus where the length of the obstruction is a little longer, often more than 3 centimeters. So I encourage you to read our study. We described this technique and how we treated these patients. Patients did find the procedure was technically successful in all patients. Dysphagia scores improved. And the goal here was to help these patients swallow liquids and tolerate their secretions, because many times these patients are unable to even swallow their own saliva. They have a very poor quality of life where they have to constantly spit or use a suction all the time. And so the goal here was to help these patients swallow their saliva, drink liquids, and even tolerate some soft solids. So we were able to demonstrate these endpoints in these patients without any major adverse events. And so to summarize, this is a novel technique for therapy of complete esophageal obstruction. It uses the basic principles of endoscopic submucosal dissection and per oral endoscopic myotomy, or POEM, and has been very effective in treating these patients. So I encourage you again to read our study, and feel free to call us if you have any questions or comments. And once again, thank you for your attention. Thank you for watching.